Hello, good morning friends. We will start with a new class. In a previous classes we have discussed some point related to metabolism protein, and in today's class we will start with a continuation part of fourth unit protein, that is deficiency or excessiveness of protein. Excessiveness of protein is rarely occur. Deficiency it is also major occur in India, and deficiency of protein will be leads to protein energy malnutrition. Regarding this protein energy malnutrition, it is more commonly occur in the age period of 1 to 5-year children, means preschool children, and it is on an average 43 to 44% of children are suffering with a severe protein energy malnutrition, and 8 to 9% of children are suffering from a mild moderate protein energy malnutrition. And this protein energy malnutrition more commonly occur in India states like Gujarat and Madhya Pradesh. Among the Karnataka, which are the district will be having more cases of protein energy malnutrition, means Raichur and Ballari, those will be having more cases of protein energy malnutrition. And will be start what do you mean by protein energy malnutrition? How we can be define the term protein energy malnutrition? Means it is a pathological condition arising due to lack of dietary protein and or energy. It is a pathological condition arising due to the lack of dietary protein plus energy or protein alone. That condition will be called as a protein energy malnutrition. Why this protein energy malnutrition happen? Means due to the causes like inadequate intake of food. Inadequate intake of food, otherwise we will call it as a food gap. Inadequate intake of food in the nature of both in a quantity and quality. Both quantity of food and quality of food is less. During that time there is a occurrence of chances of PEM cases. And one more cause, infection. First cause is inadequate food intake. Second cause is infection. Which are the infection? Means diarrheal infections, typhoid or dysentery, and respiratory infections, measles, worm infestations. Those will be leads to PEM. How? Means during the period of infection there is an increased demand for the calorie and protein, and during the period of infection there is a decreased rate of absorption of nutrient and utilization of the nutrient. Both these will be leads to increased chances of occurrence of protein energy malnutrition. And one more thing, this infection and protein energy malnutrition will be called as a vicious cycles. One is dependent on another. As like infection leads to there is a deficiency of nutrient deficiency. This nutrient deficiency leads to protein energy malnutrition. And in case of protein energy malnutrition, immunity will be decreases. Whichever the children is going to suffering with the protein energy malnutrition, that children immunity level is reduced. If the immunity level is reduced, that child is risk to get a infections. That when the immunity is decreases, that child is risk to get a infectious process. That's why infection and protein energy malnutrition are vicious in nature, vicious cycle, cyclic in nature. Okay, this is about the how the causes and how the protein energy malnutrition will arise in children. And one more thing, after the arrival of protein energy malnutrition, it shows the major two clinical features in the form of kwashiorkor and in the form of marasmus. Yes, kwashiorkor will be having it's the initial step. It is having only deficiency of protein. In case of marasmus, both protein and energy is lacking in the children. That's why it is a severe form of PEM. Marasmus is a severe form of protein energy malnutrition. Some of the clinical features will be see with the image. Just a minute. Yes, friend, here we are looking the image of difference between the kwashiorkor and marasmus. In this we will be having headings of features related to this PEM, and which are the changes will be happen in a kwashiorkor and which are the changes will be happen in a marasmus. First feature is deficiency. Deficiency in case of kwashiorkor, that is only protein, but in case of marasmus, protein plus energy. Okay. Regarding appearance, usual appearance, kwashiorkor baby is usually having sugar baby, means obesity in nature because of swelling. Usually we will be having a generalized swelling in a kwashiorkor, and this marasmus baby is usually thin because of muscle wasting. And regarding growth, both the condition will be having symptoms of retarded growth. Height and weight is going to become retarded in both conditions. And regarding edema, generalized swelling, types of edema is in kwashiorkor, pitting edema is present. Pitting edema is present because of interstitial fluid collections, and this pitting edema is usually absent in marasmus. Regarding activity, kwashiorkor baby is usually having active in nature, but marasmus baby is usually being with a apathic, means inactive state. And next one, regarding appetite, hungerness. Regarding appetite, kwashiorkor baby will be having a normal appetite, means good appetite, but marasmus baby will be having poor appetite. Regarding muscle wasting is present in kwashiorkor and markedly present in marasmus. Mental changes is common in kwashiorkor. Mental changes usually cannot be happen in marasmus. Regarding hepatomegaly, enlargement of liver, absent in kwashiorkor, but hepatomegaly is present in marasmus. Regarding infection, this kwashiorkor baby is more prone to get infections, and marasmus baby is less prone to get infections. And hair changes is more common in kwashiorkor. Hair colors will be changing, showing the symptoms of plague signs, and this will be uncommon in marasmus. Anemia, there is a decreased level of HB. In case of kwashiorkor is very severe, and in case of marasmus mild. And subcutaneous fat reduced in both condition. Just a minute. Yes, subcutaneous fat is reduced in both conditions, and subcutaneous fat is totally absent in case of marasmus. Regarding facial features, moon shaped facial appearance is present in kwashiorkor because of collection of fluid, generalized edema and puffiness of face, and this is opposite to in case of marasmus, monkey face, because of maxillary bony prominence or appearance more. These are the clinical features. Difference will be seen in kwashiorkor and marasmus baby. Yes, here we will be have a imaginary diagrams. This is a baby of kwashiorkor having a generalized edema and collection of fluid in abdominal cavity and moon shaped face, and the generalized edema is present. And this is a image of marasmus children having a severe subcutaneous fat wasting and thin in appearance, and all the internal skeletons are appearing here. Okay, these are the imaginary difference between the marasmus and kwashiorkor. And now we'll be start with the diagnosis and treatment of marasmus. Just a minute. Yes, till now we are discussed some clinical difference between the marasmus and kwashiorkor. Now we will be start with the Diagnosis. Usually diagnosis will be conducted in the form of history collection and nutritional status assessment and anthropometric assessment with the help of ANM worker and health worker, field health worker. After that, we will be have some preventive measures to reduce the cases of protein energy malnutrition. Which of those preventive measures will be start with the point wise. First point is health promotion. Second point is specific protection. Third one is early diagnosis and treatment. Fourth one is rehabilitation. With the help of these four measures, will be prevent the nutritional deficiency, protein energy malnutrition. First, we will be start with the health promotions. Regarding health promotions, what are the points we are looking here means care of antenatal mother, care of postnatal mother regarding antenatal checkup, measurement of weight gaining and balanced diet, supplementation, health education, immunization of mother, and regarding postnatal care like hospital delivery, hospital cesarean delivery, and feeding up and postnatal care of mother in a hospital to prevent the infectious process. Those things will become as a ANC and PNC care. And next one is health promotion aspect, breastfeeding. Up to 6 months, baby should be feed with the mother breast milk only. That we will call it as a exclusive breast milk. When the crossing of 6 months, we will be start with the complementary feeding, that is weaning. And the breast milk is insufficient for the newborn, that time we will be initiate the supplementary additional feeding along with the breast milk, that will be called as a weaning in the form of fluid, in the form of semi-solid, and lastly solid in nature. Will be initiate the external food for the children. And next one, here we will be start with the nutritional education to mother, how to get a balanced diet and how to feed the baby and how to maintain the body weight and how to being a active form and how to prepare the balanced diet. Everything will be a part of nutritional education. And next one, family planning. Regarding this, prevention of serial there is a maintenance of gap between the two babies. After the birth of the first baby, how much duration, minimum 2 years we have to keep the duration in between the alternative babies with help of family planning. That thing will become in the part of health promotions. And next one, specific protection. Regarding this, we will be provide a find out the cases of PM, providing a specific protein rich diet, that is in the form of Hyderabad mixture, that is in the form of egg, that is in the form of milk and banana. Calorie dense food we are going to supply for the PM children. And along with that, immunization of children, which are vaccine preventable disease, infectious disease, we should be prevent with the help of immunization of the children. And next one, food fortifications. We have to enrich the foodstuff to increase the nutrient content being in the foodstuff. For example, fortification of wheat with the iron, fortification of milk with the vitamin D, and fortification of salt with the iodine. Those things will become as a part of specific protection related to diet. And next one, early diagnosis and treatment. Here we have to conduct a periodical surveillance. Which are the areas are more prone to get a protein and malnutrition, and what are the districts are more prone, and what are the main causes for protein and malnutrition. That's why we have to conduct every 5 year or every 10 year surveillance for the identification of cases. And with the help of growth chart, usually we will be regularly monitoring the growth chart in a preschool children in a setup of Anganwadi. Road to health chart. We can be early diagnose the cases of growth retardation, and that child we can be send it for the further treatment for higher center, and early treatment of any infectious process, and supplementation of or administration of ORS solution in case of severe diarrhea. And next one, supplementary feeding usually we will be conducting in Anganwadi along with the home diet. And deworming process for the prevention of infestation of hookworm infestation. It is one more major cause for the nutritional deficiency. These things will become in the part of early diagnosis and treatment. And next one, rehabilitations. Regarding rehabilitation, after the severe form of protein energy malnutrition, we are referring the children to the higher center, to the district level. There we will be have a NRC, Nutritional Rehabilitation Center. There we will be get a proper nutritional assessment and biochemical assessment. Along with that, we will be provide a hospital treatment to reduce the infectious process. And lastly, we will be educate the mother to take care of home diet or preparation of home diet and how to feed the baby. Everything will be part of rehabilitation. Okay. In a district level, in a Karnataka, every district will be having a nutritional rehabilitation centers. And one more thing, regarding as a part of protein energy malnutrition, we will be provide a supplementary diet, usually in the form of Hyderabad mixture or Davangere mixture. This Hyderabad mixture is good for the protein energy malnutrition children, and it will be having 86 gram of Hyderabad mixture will be provide 330 kilocalorie of energy and 11.3 gram of proteins. And this Hyderabad mixture is made up of with the help of wheat, Bengal groundnut and jaggery. Okay. By this we will be complete today class. In upcoming class we will be discuss some point related to next unit, energy. Okay, by this we will be complete class. Thank you so much.